Can braces affect your kid's ability to play sports? Today, Dr. Cruz is going to tell us all about that and everything else you want to know about your kid playing sports while they're in braces. So stay tuned. Dr. Cruz, can braces affect the ability of a kid to play sports?
No, it certainly can't affect the ability. I mean, gosh, it would be nice if it would enhance their ability. I would be so popular, right? Everybody would want braces so that they could jump higher or run faster. No, it doesn't either enhance or deter their ability to play sports. I think the bigger concern is just how to protect the lips and the tongue and the teeth, and prevent braces from breaking off. And so there are definitely some recommendations that we have with regards to that, things like mouth guards. Yeah.
Are there any other concerns parents have about their kids with braces playing sports?
Sure, especially contact sports. So we have a number of patients that are into mixed martial arts, jujitsu, wrestling, football. And so all of those sports, there's even basketball, soccer. And so all of those sports, you've got to be really concerned about just protecting the teeth in general. And that's whether you have braces on or not. And so we definitely go over that with our families and explain to them the type of mouth guards that we would recommend to help protect those valuable teeth.
Are mouth guards necessary for kids?
For many sports, they are. I've seen some pretty hellacious injuries as a result of not having mouth guards on. And like I said, this is whether you have braces on or not. The thing about this, there's a number of different ways to kind of look at this, but one of the common reasons why there's so much damage is that if there's any sort of contact to the lower jaw, it'll cause the upper and lower teeth to clack together. And as a result of that, teeth start fracturing or getting knocked out. And so at the very least, if you can have some sort of cushion or barrier in between the upper and lower teeth, it goes a long way. It also goes a long way in protecting the jaw joint, the TMJ. And so it's quite a bit more simple than people realize. You don't have to have some really fancy, expensive custom mouth guard to provide quite a bit of protection.
Dr. Cruz, can braces affect the ability of a kid to play sports?
There are a number of companies. The company that we typically recommend is Shock Doctor. I like the product that they make. It's effective. It's relatively inexpensive. I want to say $15 to $20, and it's easily accessible. So, you can you can get them on Amazon. You can get them on at Dick's Sporting Goods. There's a number of places that you can get them. They're relatively easy to purchase as far as figuring out what size. I want to say that they have two sizes, a youth and an adult size. And so you just want to make sure that you don't make this more
Are there any other
complicated than it
concerns
needs to
parents
be.
have about their
And they're
kids with
also
braces playing
adjustable, right? And
sports?
so sometimes they don't fit perfectly right out of the package. We offer to our patients to customize them ourselves. So bring them into the office and we can definitely polish them or reshape them so that they're more comfortable. It's pretty rare that we have to do that. I'd say 95% of the time, they're super comfortable and easy to wear right out of the package. The more common ones are taking a blow, sort of contact to the lips, and causing some sort of cut or laceration to the inside of the lips or the cheeks.
Are mouth guards
And
necessary for kids?
it can actually increase a bit from there to where the bracket or brace will become embedded in the lip, and so you have to sort of detach it from the brace. Those are the most common. As a result of that, brackets get popped off the teeth. And so you have loose brackets, which isn't a problem. We don't want to make that a problem. In fact, as a side note, what used to happen decades ago is that we have glues or composites that were really, really strong. We wanted to avoid this issue of brackets becoming loose. And so it actually became problematic because it took such a heavy force load to have the bracket come off of the tooth that it would take enamel with it. And so interestingly enough, we actually have composites that are designed to fail at a certain force load so that when it does come off, the tooth is still intact. You don't want the glues to be, too strong. You want it to fail at some point.
Dr. Cruz, can braces affect the ability of a kid to play sports?
There will be kids that want to explain that they don't need to wear a mouth guard, and then sometimes parents will acquiesce to that. And so, more than anything, I just encourage parents to make sure that their kids are wearing that mouth guard. And I get it. I understand that in some sports where you have to communicate quite a bit, you don't want some big, bulky mouth guard. And so that's the other reason why I like Shock Doctor. They have what's called a single arch option that's quite a bit smaller. They've got the double arch option, which is probably more appropriate for kids that are doing MMA or boxing. And so the key
Are
is
there any other
just
concerns
make sure that
parents
they're wearing
have
the,
about
the
their
mouth
kids
guard.
with braces
What
playing
has helped
sports?
tremendously over the last decade is that it's become cool for professional athletes to wear mouth guards. You'll be watching football or basketball and you'll see them kind of pop it in and out of their mouth, or it's almost like they're playing with it in between plays or points. And so that helps. If LeBron's wearing a mouth guard, then clearly it's cool enough for me to wear a mouth guard. So that's helped. Yeah, just about anything is reasonable. There are a number of kind of meal replacement bars that are on the softer side,
Are
to where you
mouth
can
guards
relatively
necessary for
quickly
kids?
get in pretty good nutrition. There are some bars that are really hard and sticky and crunchy, but there are a number of excellent kind of protein bars out there now, to where you don't want something that's like, oh my gosh, this is going to be a hassle. This is going to take me 20 minutes to eat this. I don't have time for that, right? We're actually playing a sport here. And so I love bars, for me personally, and for my daughters. That's usually what I recommend.
Hmm.
We give all of our patients a kit to take with them. So it's not just a toothbrush and toothpaste, it's also floss. It's floss threaders. There's an amazing product called the platypus. It was actually a hygienist that invented it. And so it's these floss picks, so you can quickly floss in between the teeth if you have braces on. Most of those floss picks don't work because they're so bulky that they bump into the brace or the wires, but the platypus is specifically designed. It's an odd name, I know, but the platypus is specifically designed for patients that have braces on. So, if you've got that kit with you, it makes it a whole bunch easier to at least do a reasonable job in keeping your teeth clean.
How do you recommend parents balance their orthodontic appointments with the busy sports schedule that kids often have?
That has been a major issue for the better part of my career. And I'm actually happy to say that within the last year, we've come up with a pretty amazing solution for that. So I know, Rich, you and I have talked about this a number of times as far as dental monitoring and the
Yeah.
scan box. And so now, with all of our patients being able to scan their teeth once a week, and we can keep track of their progress with regards to their treatment, it has had a really big benefit in being able to space out appointments. And so now we don't have to see our patients quite as frequently, but we can actually offer better care than we've ever been able to offer before. And so, here in Southern California, our kids are active, and I'm sure that's true across the entire nation. And so, club sports have become increasingly more and more popular, to where, sports are dominating a big portion of our family's time, especially being on the road. We've got a number of athletes that are traveling all over the nation. And so, because of the way that we're able to use dental monitoring in the scan box, we can actually really work with our families' schedules to be able to not inhibit their ability to play sports. It has been a massive benefit to our families.
I've heard dental monitoring allows for dynamic scheduling. Can you tell us what that means and how that benefits the patient?
Yeah, we're really excited about dynamic scheduling. It's taken me a year to be willing to kind of embrace it. I'll sort of explain what it is. And so, because the technology of this scan box is so good, it uses artificial intelligence, AI, to be able to determine a number of things. So, for example, when you put a wire in to connect to all of the braces, the scan box will detect when that wire is passive. So, in other words, when the wire has fully expressed itself. It can also check using the photos to determine when a bite has been corrected from elastic wear or when the proper amount of expansion has been done. And so, what used to be so common within orthodontics is that you'd come and see your orthodontist every 6 to 8 weeks. And some of those appointments would be valuable because there'd be something that would need to be done. But a lot of those appointments would just be a quick check to see whether or not things are progressing. And if they are, then good job, keep doing it. Or if they're not, then you communicate with your patient that you need to do whatever it is you need to do, whether it's rubber bands, etc. And so you can imagine that there would start to be some frustration on parents' end because you've had to pull your child from school, drive to the office,
Uh,
sit down for the appointment that ends up just being a couple of minutes because it's just a quick check, and then drive your child back to school. What ends up being a 5 or 10 minute appointment can actually be an hour and a half to 2 hours from beginning to end, and really inconvenient. And so now we are able to see our patients when it makes sense. And so we use this scan box to let us know when it's time to do the next step in treatment. And so now our patients are coming in and actually having intentional appointments. We're actually providing, intentional, efficient appointments. And so what's happened is we're able to see our patients every 10, 12, 14 weeks on occasion. So for busy patients, whether you're a young professional or whether you're an athlete that's traveling a bunch because of sports, we're really able to provide, number one, excellent treatment. That is always paramount. It's not like we're trying to cut corners here, but our patients come in when it makes sense. So the way that dynamic scheduling works is that when you leave the office, you may not have an appointment scheduled, and then we're monitoring you every single week through the scans with the scan box, and then we'll give you a notification and we'll actually call you when it's time to come in. Our patients have loved this. Initially, I was skeptical because it feels so odd to have a patient leave without a scheduled appointment. You think, oh my
mm.
gosh, this is not the right way to do things. I've never done this before. And so we've dipped our toes in the water for several months. And now we're to the point where a good majority of our patients are actually using dynamic scheduling, and they love it. They really, really appreciate that we're respecting their time, and that when they come in, they know that there's going to be some real value to that appointment.
Are there treatments or technologies that reduce the time kids need to wear braces?
There's been a number of appliances that have come out over the years, and I've got to be careful as to how much I speak to it because it's been a few years since I've used these products. They were basically appliances that would vibrate the teeth, and there were some studies that suggest that that would increase the rate of movement of teeth. In my office, in our office, I just didn't find that to be the case. And
Mm.
so I don't think that those products are nearly as effective as the companies were claiming them to be. But what has been a really big shift is instead of having to be seen 15, 20, 25 times in order to complete your orthodontic treatment, the overall treatment time may be approximately the same. A year and a half or so is pretty typical, but the number of appointments to be able to achieve that has been greatly reduced. So now it's 8, 9, 10 appointments to be able to undergo your orthodontic treatment. I mean, I get it. We're a fun office. Our team is amazing, but we're not that much fun. It's not like you want to come and see us every single month. And so I get it. You've got busy lives. There are other things that you'd rather be doing. And so we really have done a great job in making sure that the number of appointments that you have to come and see us has been reduced while still maintaining, excellent care. That's what we're shooting for.
What should a parent do if a child does have an emergency during a sports event, an orthodontic emergency?
Absolutely. So once again, talking about kind of dental monitoring and the scan box, I am available basically 24/7 now. And so with that app, you're able to message us directly. I've set it up
Mhm.
so that it goes straight to my cell phone. And so I'm constantly checking it. And the good thing is that our families really don't take advantage of that. They're not texting me at midnight or 1 in the morning unless it's absolutely necessary. We've had it happen on occasion.
Mm.
And so we make ourselves very available. To your point, if it's a true emergency, you're going to need to call 911. You're going to need to have somebody that's going to be on the spot immediately. And so between 911 or between calling us, we're going to make sure that your child or yourself is going to be well taken care of.
How do you recommend parents talk to their kids about playing sports with braces and being safe?
Yeah, more than anything, I don't want it to be a distraction. Sports is difficult enough as it is, just on its own. And so the last thing I want is for them to be distracted about being really careful with their orthodontic appliances.
Yeah.
And so it kind of circles back to what we were talking about earlier, which was just make sure you've got that mouth guard in. Because if you've got that mouth guard in, then you can just focus in on whatever sport or activity you're doing.
Makes sense. Are there any sports that pose a higher risk than others?
It's all of the full contact sports. It's now end of November, and so football season is kind of wrapping up, at least for high school. And
Yeah.
so we've got a few repeat offenders in our office. I suspect that these patients are really aggressive on the field. And so, they've been seeing us every week, every other week because they've got broken brackets.
Wow.
I think one of them's a linebacker. So I think he's just constantly getting after it. And so to answer your question, yeah, it's all the full contact sports. Wrestling and football are the big high school sports where it's common that, appliances can be broken. And then at least here in San Diego, we've got some top-notch UFC fighters. So jiu-jitsu is really common here in San Diego. We've got a lot of young patients that are doing jiu-jitsu. And so once again, we're just making sure that they've got that mouth guard in.
What's your top piece of advice for parents who have kids starting braces who are active in sports?
Let them be active. The last thing we want to do is be a hindrance towards children being active. I think we'd all agree as parents that it's pretty common that kids are on their phone and on social media and indoors. And so the last thing I want to be is another reason as to why kids aren't being out, going outside and being active. It's relatively easy and simple to be able to protect the mouth, protect the teeth, be safe with things like a mouth guard. And so I want to make sure that kids are out there being active.
Great. Dr. Cruz, I think this is going to address a lot of concerns parents have with their kids playing sports and potentially having braces. Thanks again, and we'll see you soon.
Sounds good. Take care.